Good morning. This is Bill again. We're covering the concept of perfusion. Perfusion is a concept that is defined as the flow of blood through arteries and capillaries delivering nutrients and oxygen to cells. This is a normal process that requires the heart to generate sufficient cardiac output to transport blood through patent blood vessels for distribution to in the tissues throughout the body. Some of the defining characteristics that can interfere with perfusion: we have edema, shortness of breath, cyanosis, high blood pressure, smoking, sedentary lifestyle, and obesity. All of these things interfere with the act of perfusion. Edema, it slows the return of blood flow, thereby decreasing the blood flow. Shortness of breath, you're not getting enough oxygen into the blood to transport. Cyanosis, another sign of not having enough oxygen in your body. High blood pressure, it increases the peripheral vascular resistance of the body and stops the blood flow from getting where it needs to go and makes the heart work a lot harder. Smoking. Smoking always interferes with any kind of perfusion or oxygenation because you are creating a barrier to the oxygenation and perfusion. Sedentary lifestyle. You don't have enough exercise, getting up and moving around, just sitting like the proverbial couch potato, and it does not help you. And then obesity, again, because of the change in the body and the extra cellular tissue that it has to pump against. Exemplars for perfusion, I have them separated into basically two areas. One is the physical problem that is going on, tritology of Fallot, ventricular septal defect, arteriosclerosis, hyperlipidemia, hypertension, peripheral artery disease, and heart failure. Then there's the electrical side. For one reason or another, atrial fibrillation, asystole, the heart just stops. Third degree heart block, the heart is beating so slow that it's not going to help anything get through there. Ventricular fibrillation, the ventricles of the heart are just sitting there shaking. They're not producing any blood flow. Aortic stenosis makes the heart work harder because of the narrowing of the aorta. Shock, that is something that is because of fluid volume loss or overload or some of the other things that cause shock. Myocardial infarction, that one there is a combination of a physical problem and an electrical problem. Okay. Related concepts for perfusion. Now, some of these you might think of and some of them you don't. Pain is going to interfere with perfusion. Cognition, your ability to think. Elimination, gas exchange, mobility, nutrition, inflammation, clotting, and patient education. If the patient isn't educated, they don't know what to do to correct the perfusion problem. Perfusion types: there is a local tissue perfusion, and then there's a central perfusion. Local refers to the volume of blood that flows through targeted tissues. This is the blood flow that moves through the arteries and capillaries and back to the heart eventually. And then there's central perfusion. Central perfusion is generated by the cardiac output, the amount of blood that is pumped by the heart in a minute. Okay, so you got your heart rate times your volume, and that gives you your cardiac output. I hope this helps. know the definition for sure, and that of what perfusion is. And I'll see you when I see you.